Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is History of Nursing. Nursing is the art and science of caring the sick people and promoting the health and well-being of the well people. Okay, so nursing is nothing but it is meaning of the nursing is it is just art. Okay, taking care, that is art and science, including the knowledge. Okay, science, basic knowledge of nursing for caring the person during illness, caring for the sick and promoting the health, protecting the health. Okay, restoring the health of the person or promotion of health of the well person. The nursing history evolved, okay, started from instinctive care, that is untrained, unlearned natural care. Okay, so natural behavior of people to care themselves or to care the family member, that is an instinctive care without any training. Okay, so nursing is started from instinctive care, then it has been evolved as a religious services, especially by missionary services, Christian missionary services, that is a religious services and other religious services. Then at present, it is become a profession, a noble profession. Thus, history shows growth of nursing as a profession from the instinctive care or from the primitive care or from the ancient services to until it became a profession. Now, history of nursing. History of nursing includes 7 different areas of development or evolution. Okay, from primitive era, okay, that is from early period, and last nursing in the present scenario at present. Okay, how it is developed. So there are 7 areas to discuss about the history of nursing. First one is primitive era or early period or nursing in primitive era. Second area, nursing in ancient civilization of Greece, India, China, etc. Okay, nursing in ancient civilization. Then nursing in Christian era, then nursing in during the Middle Ages, nursing in Middle Ages, then nursing in modern era. Okay, there are 2 areas in modern era. Then how the nursing developed in India. So nursing in India, and last is nursing in the present scenario. That is the 7th area we are going to discuss in this session. First one is nursing in primitive era or in the early period. Nursing was based during the primitive era as instinct services, natural services, as I already mentioned. Okay, untrained, unlearned, natural. Okay, and it was trial and error. Okay, so people were trying to get rid of that particular problem. Thus, it was a trial, and at the same time there were many mistakes. That is error. Okay, trial and error method, and it was based on many superstitious beliefs. Okay, unnatural beliefs, superstitious beliefs. For example, illness was believed to be caused by evil spirits. Okay, Satan, evil spirits. Okay, and it was from the past sin of the people. Okay, so in the primitive era, people were believed that the illness, various diseases or illness were caused by evil spirits with the support of the evil spirits, or from his past or their past sin, or from the curses from the different goddess, etc. Okay, that is the superstitious beliefs. Moreover, the nursing care were rendered by the family members. Okay, or especially women in the family. So women and mostly by the tribal healers, tribal people or head of the tribal people. So tribal healers with the tribal remedies. Okay, herbal remedies. Then the treatment mainly based on use of many herbs. Okay, then rituals, traditional or cultural practices, rituals, and charms and prayers. So treatment were based during the primitive era or the early period by use of herbs, rituals, charms and prayers. That is about the first stage of development of nursing during the primitive era, okay, or in the early period. The second development or evolution is in the ancient civilization. So nursing in ancient civilization. So during 3000 BC in Egypt, okay, they learned the knowledge about the nursing and about the science from anatomy and embalming. Embalming means keeping the dead body or preserving the dead body from decaying. That is the meaning of embalming. So they started or they studied the knowledge or science of the human body from the dead body, and they preserved the dead body for a long period. And they were used many herbs for the purpose of treatment, and they were used other techniques such as massage, hydrotherapy, water therapy for the treatment or part of the treatment to cure various illness and diseases. And especially the women provided the care at homes for many illness and diseases, or those who are sick at home. Then in India, Ayurveda were developed by Charaka and Sushruta. Okay, so we learned this Ayurveda from Charaka Samhita and Sushruta Samhita. Okay, then in addition to that, the hospital were established during ancient period or ancient civilization, that is during the 3rd century, that is in BC, by King Ashoka. Okay, you can see the picture of King Ashoka, and this is Charaka and this is the Sushruta. Okay, then the role of the nurses and the nursing were described in Charaka Samhita, okay, during the ancient period in India, and we were given importance, and still we develop and we follow Ayurveda as one of the best treatment for the various illness and diseases. Then this Charaka Samhita noted about the nursing as maintaining cleanliness, devotions, knowledge of various herbal drugs, Ayurvedic drugs and remedies. Okay, that is about the ancient civilization in India during the ancient period. Then in China, the illness was explained by imbalance of yin and yang. Okay, according to their traditional beliefs, they followed it is the imbalance of the positive and negative energy, that is yin and yang. So the symbol of yang and yin is this one. So imbalance of any of these features, okay, that may lead to illness. Like that Chinese people were believed. Then they used the acupuncture as one of the best treatment in China, and massage and various nutritional diet and herbs, different types of herbs. So the illness were explained by imbalance between the yin and yang in China, and use of acupuncture, different massage therapy, and following nutritious diet, okay, specific diet, particular diet, and following various or using various herbs were the treatment for the diseases and illness during the ancient period. Then in Greece, Hippocrates, known as father of medicines, so lived in 460 to 370 BC. Okay, so knowledge about the medicines were developed by Hippocrates, we consider as a father of medicines, and he found the natural causes of the disease, that is against from the evil spirits and past sin or unnatural earthquake, etc. Okay, so natural causes for the disease were found by the Hippocrates, and he made many clinical observation of different type of disease and illness. Okay, from that he gained many knowledge. It was imparted for the treatment of the people during the period of or during ancient civilization in Greece. Then moreover, the people of Greece believed or believes Asclepius is the god of healing. Thus all the procedure, okay, treatment for illness, for cure of disease and illness were done in the temple with various traditional rituals, devotional and religious rituals. Okay, so thus temples dedicated to Asclepius considered for the place for the treatment, or just a hospital during the ancient civilization in the Greece. So the people of the Greece believed and still believes as Asclepius is the god of healing, and they followed the traditional devotional rituals for the treatment and remedy for the illness. Then in Rome during the ancient period were established many military hospitals and treated by the male nurses called orderlies. Okay, they cared the wounded soldiers. During the ancient period in Rome, they were established or developed many military hospitals. So you can see the picture of the military hospital plan, okay, in the Rome, and the treatment or the care were done by the orderlies, that is usually it was a male nurses. They cared for the or they given care for the wounded soldiers. So that is about the nursing in ancient civilization. The next is about the nursing in the Christian era. Okay, the third development evolution of history of nursing is nursing in the Christian era. That was during the 1st to 15th century AD. Okay, 1st century to 15th century considered as the Christian era. Thus, the nursing was linked, okay, connected with charity and religions, missionary services. Charity, free services, charity and religious services or missionary services. Deacons and deaconesses provided the care. That is the, usually they were the disciplines of the God, okay, or Jesus Christ. And such people called deacons, male people called deacons, and deaconesses is the female, okay, women who serve for the God, given the care during the period of Christian era. Then during this period, Saint Fabiola, okay, in the 4th century in Rome, founded the first Christian hospital. Thus, the Saint Fabiola is the founder of the first Christian hospital. That was during the 4th century in Rome. Then during 11th and 13th century by Crusades, okay, so during the period of Crusades, okay, military nursing orders, usually they were the knights hospitalers or Teutonic knights. They were traveled in the horse and they given the mobile services of the treatment. Okay, that was known as military nursing orders. So they organized their own hospitals and they introduced the uniform for the knights hospitalers and Teutonic knights for giving services and care. Okay, that is during the Crusades period, 11th to 13th century in the Christian era. Okay. Then the fourth evolution of nursing is nursing in the Middle Ages. That is an important period, that is Middle Ages. Okay. So the nursing were done by during the Middle Age by the nuns. You know what is the meaning of nuns. Then monks, then religious groups. So monks usually built the monasteries. So you can see the monasteries. Okay. They were the religious people and they follow the religious or devotional rituals. Thus, hospitals were attached. So, hospital attached to monasteries, and the treatment or care were given by the monks, nuns, and even the religious peoples. During that period, okay, during the Middle Ages, there was an outbreak. Okay, it's called Black Death. That is nothing but bubonic plague. After the plague, okay, Black Death. So there was a reduction in the nursing, okay, due to the death of many trained caregivers during the Middle Ages. Thus, later after the Black Death, the care were shifted to the untrained women. Then that led to poor image of nursing because nursing were given by the untrained women. Okay, after the Black Death, due to the death of the various trained caregivers during the period of bubonic plague attack. Thus, the Middle Age were considered as the poor image of nursing because of the pandemic outbreak of the Black Death. So the next evolution, in the fifth evolution, is nursing in modern era. Okay, that is a period of renaissance and reformation of the poor image of the nursing. That was taken place during 16th and 18th century, then later in 19th century. Okay, that is called the modern era. Okay, first is renaissance and reformation during 16th and 18th century. So there was a decline in religious nursing order during the Middle Ages. Thus, nursing became low status work. Okay, mostly it was done by the prisoners, especially prisoners, drunkards, and even illiterate women during 16th to 18th century. That was known as dark period of nursing. So, in the modern era, in the first part, during the Renaissance and the Reformation, in the first part, 16th and 18th century, the nursing was considered as the dark period of nursing as it was done by the prisoners, drunkards, illiterate women after the Middle Ages, after the outbreak of the Black Death. Okay. Then in the second part in 19th century, there was the reformation of the nursing by the contribution of the Florence Nightingale from 1820 to 1910, and she is the founder of the modern nursing. Okay, she improved the sanitary conditions during the Crimean War, a famous war occurred between the 1854 and 56. During the Crimean War, she was treating the wounded soldiers. She reduced the mortality rate, death rate of wounded soldiers from 42% to just 2% because of increasing or improving the sanitary condition for the wounded soldiers. She reduced the mortality status or statistics of the wounded soldiers from 42% to just 2%. She started Nightingale training schools at St. Thomas Hospital, London during 1860. So these were the olden 1860 that Nightingale training school or St. Thomas Hospital, and now at present this is St. Thomas Hospital, London. Okay, she stressed or emphasized about the cleanliness, ventilation, adequate and proper ventilation, and hand washing techniques, and maintaining the records, okay, documentation system. Thus she given a quality based, standard based nursing care. Okay, so in 1860 Nightingale started her training schools at St. Thomas Hospital, London, where she trained both nurses and doctors. Okay, during the period she stressed about the cleanliness, ventilation, hand washing, and maintaining the documentation and recording patient record system. That is about the reformation of the nursing during the modern era. I will discuss in detail about the various contribution of Florence Nightingale in nursing and modern nursing in my next video. Now the sixth evolution is nursing in India. So let us talk about development of nursing or historical development of nursing in India. So in ancient India or ancient period, we came to know that Charaka and Sushruta Samhita described nursing qualities, nursing services, Ayurveda services, etc. Okay. Then later the missionaries who came to India were introduced the modern nursing and services in India. That is during the 17th century. As you know that Dr. Ida Sophia Scudder, who was the founder of the CMC Vellore, Christian Medical College Vellore, like that many Christian missionaries introduced nursing services, modern nursing system and modern nursing services in India. And the first training schools in India started in St. Stephen's Hospital, Delhi in 1867. And the first nursing school to start the GNM course established in Madras, okay, Madras Hospital, later in Bombay, Calcutta, etc. in the late 19th century. Then in addition to that, Indian Nursing Council, okay, INC formed in 1947 for the regulation and control of the nursing education, to imparting the quality education to render the quality nursing services and comprehensive nursing services. Then the last part is the nursing in the present scenario. As you know that today nursing is become a profession. Okay, nursing is a recognized or noble profession, sir, with BSc nursing, MSc nursing, PhD, okay, and moreover post-doctoral programs also present to increase the standard and quality of the nursing services. The nurse's role has been changed, okay, from the hospital to the community and in the education sessions and the research area, administration, hospital administration area, etc., etc. We have extended and expanded roles in different areas in nursing. Okay, so that is the development of or historical development of nursing in the present scenario. So that's about the topic regarding historical development of nursing. So hope this video really benefits in your studies and exams. So if you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next video. Most probably I would like to upload a video regarding contribution of the Florence Nightingale in modern nursing. Thank you.